question that's got a little smiley face and a hand, or maybe just a hand, and you can raise your hand as well, and I'll answer any questions if people raise their hand. And failing all of those options, if you don't have any of them, then it's basically you can sort of ask questions as we go. Just unmute and say, sorry, I've got a question, and I'm quite happy to take the questions. Or at the end, if anyone then at the end wants to save their question because it hasn't been covered maybe by the topics that I'm covering, wait to the end then, and I'll go to anything I haven't already covered. And don't feel shy about asking any questions, because the chances are that everything that you're asking, other people want to know as well. So yeah, so use your chat box or put your hand up, or if it's on the topic that we're talking about, just unmute and ask a question. If it's on a totally separate topic that I haven't covered, just wait to the end and we can go over it. Okay,
that's
so
lovely.
Yeah.
Thanks, Leanne, that's fabulous. We are recording this session for anybody who can't attend, so if you don't want to be identified on a recording, then please don't speak. I think we've got virtually everybody in the meeting now, so I'm going to turn my camera and microphone off and move over to support the questions. And we're ready when you are, Leanne.
Okay, great. So I'll probably jump straight on to probably the most loaded issue of everything at the minute. So and that's where it's probably a good one to get people to talk to me about it if you want to put your hand up or chat about it. So at the end of last week, we had like a national meeting whereby some of the information that came from it went viral to many nursery settings and early year settings and primary schools, stating that people who work in nursery settings are eligible for vaccine now, and it has been shared. The origins of the messages we're still trying to 100% get to the bottom of, but unless you are working with medically, clinically vulnerable children, we are not vaccinating anyone outside of that remit at this time. I think the email that went around and has been shared and screenshotted and other things was stating that nursery and early years provision comes under social care as like a career area, that it's a care element. It wasn't specifying that nurseries are now eligible for vaccine, because the vaccine criteria by the JCVI is very, very different. So yeah, just bear in mind, if you have had that, if it is creating confusion, and we are escalating this nationally because this caused a regional problem, actually a national problem, but we've seen the ramifications regionally, then please don't book vaccine. You aren't eligible for vaccine unless you are supporting children who are clinically vulnerable, which includes things like any lung conditions, heart conditions, that if they became unwell, they are have a lower chance, or a more higher chance of having a very severe illness. So please, if you do have any children in your setting, do contact the early years team, who can forward that on to me, and I can forward you on to the people who can get the vaccine to you, and can book those appointments just for the people who are supporting that child. And it's worth also thinking about going forward, if that child is going to move into another setting within the nursery, think about if they're going to move, say, from, I don't know, the toddler room into the preschool room, you may not want to vaccinate the preschool room, the toddler room right now, because actually they're moving and they won't be vaccinated or won't be immune by the time they move up. But you might want to prepare that room for when they move in, so that everyone in that room is vaccinated. So do contact the early years team if you have clinically, medically vulnerable children, but unfortunately that doesn't include the SEN and other areas. There is a national confusion now because of this email that's gone out. We as a local area have been very clear for ourselves that this is just medically vulnerable children. Even myself last Friday, I was having a womble going, what's going on? Because 119 were letting people book vaccine, etc. Even I wanted to work out where it had suddenly come from, but it's only for those with clinically vulnerable children at this time. So if you do have any, do contact the early years team, who can forward that on to me, and I can forward you the link to book vaccine for those that are working with clinically vulnerable children. So I just thought I'd get that one out of the way. Is there anyone who's got any questions? Please pipe up or jump in the chats or anything like that. No, that was quite easy to get through. So the next one really is around cleaning, and we have discussed this before. So obviously cleaning is really, really important because you've got lots of little hands touching lots of surfaces. It must be absolutely exhausting for you to make sure that you're covering everybody and making sure you're cleaning as much as you can. It must be, you know, really, really exhausting for you to clean everything. But we have to keep going with that. It's still just as important as where it ever has been. Removing any soft toys that can be chewed or left wet. You know, getting those out with the facilities as much as possible, you know, removing them altogether, and using mainly any toys that can be wiped down at the end of each session, not sharing toys between different groups of children. And I know lots of areas have invested in fogging machines. They're great, but they're only really great when the surface is already clean, which I know every time I say that they go, of course it's clean, because you're doing so much deep cleaning, and the fogging is just that final, you know that you've definitely done everything. If you are paying for an external contractor, or ever pay for an external contractor for do fogging, then it's not worth it. If you bought your own machines, fine, but nothing will replace a good old deep clean. So what PHE have said is that although fogging can be good, that you don't have to do that as long as you're doing your deep cleans of touch points of toys and other bits. And this also refers to things like cups and sharing of cups, and staff who are touching cups. It's just making sure that staff, obviously you must have sanitized your hands to the point where they're down to their bone, but it's just really making sure that anything that can be shared, and again, not splitting them between groups. So I think you all know that really, really well. I don't think that's anything new, but it's just really highlighting still that cleaning is really, really important. We have had a few nurseries that have said over the last few weeks, because we are still seeing cases in nurseries. I haven't prepared the presentation today because with half term I was expecting, even though I know that you're all open, I was expecting less people today. So next week I am going to start presenting early years data, so you can start to see how the cases are going. We have had some nursery settings and early year settings have to close, and when they have, there's been quite a knock to the income and the financial impact of that. Please, again, do contact the early years team if you are wanting some further advice around financial support, and they can send you some links and some guidance around where to make claims. Some of your settings haven't been making claims that you are eligible for because of fear of how to do it. You're not too sure how to do it, whether you'll end up claiming for something that you're not eligible for and then having to pay stuff back. I'm hearing quite a bit of that. So again, if you are experiencing that, please let the early years team know, and we can potentially do a whole presentation, maybe 1 week, on just financial things and financial areas. And we can take that from there. So the hope is that going forward we can provide some guidance to you. So at the minute it's just links and things and where to go. If we do find that there's a number of you who are struggling financially, then going forward we can look at how we can support you better by having maybe a webinar just on finances and just on other things. And so please let us know. We know obviously that a lot of you are now accessing LFT test centres, and it's just reminding everyone that LFTs are for your weekly or twice weekly screening, to use those as much as you need to. If you are experienced or have had cases in your setting recently, I know that most of you are supported by me anyway as that's happening. You're allowed to use the LFT centres as much as you like if you're not a close contact. So if you have maybe a few parents who've tested positive or other things happening in your setting, and you have anxieties in your team and your team are wanting to get tested more often, as essential workers they can go and get LFT testing and support that way. So please use the LFT testing centres. They are there for you to use as essential workers, and they can be used to reduce any anxieties by people testing as much as they can. Now, these aren't perfect. There are times that someone can test and then later on they can test negative, and later on they can develop symptoms and become unwell. They are the best that we've got, and in any screening program or any testing program, you have sort of caveats to how the tests are accurate and how they can be used and other things. So we are finding that sometimes there are people who have tested negative on the Monday morning, come the evening they've fallen well, and then they go for a PCR and then they test positive. And bear in mind that the test is good. It does pick up most positives and picks up many positives that didn't know they were positives, and they were then confirmed by PCR, etc. So it's really important that even if you test negative by LFT test, please do keep to your social distancing. I think lots of people in the community, more so than in your settings, are finding that if they test negative, then that makes them feel that they're safe for a day or two. You're still not. You can still then develop symptoms throughout the day and then test positive. We are still trying to understand the science of that and understand why that's happening. It could be a couple of things. It could be the fact that although you are unwell, you aren't infectious and you aren't emitting virus from your nose and your throat. That could be one thing. And so actually, when you are picked up by LFT, you are highly infectious at that point, which can happen if you've got symptoms or not. It could be the fact that the test missed you. Either it was a bad sample or the test just didn't pick it up. It just didn't pick up the threshold at that time. And it could be the fact that the test was just a bad test that day. Either, sometimes they don't always pick everything up, and we're trying to work out why. And so ultimately, it's just really important that even if you LFT test negative, that you should still keep to your distancing as much as possible. Now, that's not always possible between the staff and the children. In your settings, it's just not possible, but it can be possible between the staff in the bubbles themselves to remain at a distance as much as they can. So if you do have a staff member test positive, it doesn't always mean that the other staff member is then, a close contact to that staff member. In most cases, it's going to come from the children anyway, but it's always worth keeping a distance from those that you can. Now, your groupings need to, I know we've banged on about this before, your groupings need to remain as separate as possible. So there's no crossover. Obviously, that's not always physically, operationally possible. You have covers that you need to have. You need to have times that that you do have someone who steps in when someone needs to have a lunch break, go to the toilet, that kind of thing. But it's also when that person does that, they need to maintain a distance from the staff and try and maintain a distance from the children where they can. Again, this is just advice, this is just a guidance. It's not always physically possible in your settings, but do it as much as you can. That brings me on to PCR testing. So PCR testing has been found to be a bit more accurate than the LFT testing. We are now reserving PCR testing really for when you are unwell, or if you are a close contact and isolating, or if you had the top 3 symptoms. Those are the main reasons for PCR. PCR is actually really good and really quite accurate, although LFTs are being found to be on the same par, same level of accuracy. The only problem with PCR tests is it can pick up historical positives. So if you've tested positive in the last 90 days and you then do another swab of your nose, even though you are now no longer infectious, it picks up the dead virus in your nose, so you can test positive for some time. Now, nationally, we've been having issues of what to do about that. So if you have tested positive previously and you've tested positive again, what do we do? Because we know that there is that problem. So they've redone the guidance very recently that states that if you are within the 90 days, you don't need to do a PCR test, so please don't do one, is the first thing. But secondly, if you do PCR test positive and it's outside of an isolation period, then we need to follow the isolation protocols. So very, very recently, they're redoing a lot of that stuff, and they've re-said that now if you have accidentally or gone for a PCR test and you are found to be positive, we do need to follow the protocols and isolate everyone and lock them all down, even if that we know that's likely historical. Now, this is more important when the person does develop symptoms again. So if they develop symptoms again, then 100% that's not, that's not in question. Because we do know that the immunity at the minute to coronavirus, the natural immunity, is about 3 to 4 months. And therefore, this could be a whole new infection and we have to lock everybody down. So it is really frustrating around the fact that that it's likely an echo, but if someone does test positive, unfortunately, that's what we need to do. We need to isolate everyone going forward. Now that brings on the question about vaccine. So if you've been vaccinated and you then go for a PCR test and that's positive, what happens then? The guidance has been again reiterated by PHE that if you test positive by PCR, even if you've vaccinated, you must lock everyone down. The guidance is everyone must isolate who are close contacts and you must follow the previous guidance, and that hasn't changed. So although we're vaccinating, we are seeing that there is still some transmission with the vaccine, and we're trying to understand the science behind that. So if someone does go for a PCR test and they are found to be positive, then we have to self-isolate all close contacts as if they haven't been vaccinated. And the same for the LFT tests. If you're doing your 2 weekly LFT testing, even if someone has PCR positive before, and even if someone has had both vaccines, if someone tests positive on an LFT test, we must self-isolate everybody and act as if the transmission, that there is possible transmission, and we're still going through that at the minute. So it's just saying that that's the guidance and that's what we're following. It doesn't matter if you've previously PCR tested positive or if you've vaccinated. If you've LFT tested positive or you PCR test positive, we act as if you are positive and everyone needs to self-isolate. And then finally, that just brings me down to isolation periods, just to recover all of that again. So if you test positive with symptoms, we go from 10 days from when your symptoms started. So you isolate for 10 days when your symptoms started, releasing on the 11th day. We count the first day as day 0. So if you test positive, say on the 10th, if you develop symptoms, and test positive on the 10th, you isolate from the 10th to the 20th, returning back to usual activity on the 21st. Anyone who's a close contact of you still isolates from that contact for 10 days. So they would isolate for the same amount of time from the 10th to the 20th, releasing back to usual activity on the 21st. Now, if someone tests positive, but they haven't had any symptoms, we go from that test date. And again, if that test was on the 10th, they go from the 10th to the 20th, releasing back to usual activity the 21st. However, if you test positive, but do not develop symptoms until a day or 2 later, you must restart your isolation period from when that symptoms started after the test and isolate for 10 days from those symptoms. Now, when we're spotting close contacts of anyone, so if we want someone's tested positive, we need to isolate all the close contacts. We include everyone that has been a close contact on the day that they either developed symptoms or tested positive, and the 2 days before. So if someone was in work all week, Monday, Tuesday, Wednesday, Thursday, Friday, they became unwell on the Wednesday and tested positive on the Friday, then we would include everyone who'd been in contact with them on the Monday, because it was 2 days before, the Tuesday, the day of the test, and they shouldn't be in the setting, but should they be a close contact to someone, you'd still include everyone on the Thursday and the Friday. But you'd think that obviously if they developed symptoms on the Wednesday, they wouldn't be in after that day. Although in some of our schools, some of the kids have gone in, they became unwell on the Wednesday, they went for a test on the Wednesday, they remained in school all week and then tested positive on the Friday. And the school are like, do we just include the Friday, the Thursday and the Wednesday because that's when they tested? And it's like, no, because they were unwell on the Wednesday, we include the 2 days before then. People isolate from their last contact with the person, so they wouldn't they wouldn't then go from any test dates or anything. It would be from their last contact. So if their last contact with that person was on the Wednesday, they isolate for 10 days from that Wednesday. If their last contact with someone was the Friday, then they would isolate for 10 days from the Friday. So you always isolate contacts for 10 days from their last contact with somebody, and that's the isolation periods. The only time it changes is when you're in a household, and if you're in a household, then we go from the first person who develops symptoms in that household. So that's me rattling through all the things I think I've mostly covered before, except for recovering the things about vaccine access and then also financial support. So obviously do message us. I've got Gally comments saying yes, to have some discussions around that. Now, this is your opportunity now just to kind of jump in if you've got any questions or any queries that you want me to cover. And I do promise that next week I will do the presentation on early years data so you can start to see what's happening locally. Oh, actually, I will do quickly the presentation on our local data. Just bear me 1 second. I'll just load that up. Because I do like to show that to everybody because I do have that. Right, if I now just share my screen. Can't believe I've got to do that. Right, so you should all be able to see my screen now, and I'll just show the data, which is really good news. Obviously, it's not early years, but it's still really good news. If I just put present on. So as you can see, the data for Warwickshire, come on, is still coming down. So the 7-day rolling average was 90, which is absolutely brilliant. So that's 90 daily rate, and the 7-day rolling average for across the county is brilliant, because at one point we're at 492 in a day. So now we've come down to 90, 400 less than where we were at the end of December, which is absolutely brilliant. And that's for the whole of the county. All areas except for North Warwickshire are coming down. North Warwickshire, I've been looking at those cases, and it appears to be, from what I gather, you know, as you can see, their numbers are really low. It's just the fact that the population in North Warwickshire is a lot smaller than the other areas, so it doesn't take many cases for them to see an increase. And it appears to be that we've had, I think, a few small gatherings of households, because we are seeing a number of households clustered in one particular ward on one particular street, and that is enough. If we have 12 cases, say, that's enough to push us into a higher rate. As you can see, for Warwickshire, we're at 153. So the last four cells of the table, it goes Warwickshire, Solihull, Coventry, England. If you pan across to the right, you can see 153.8 is the 7-day rolling rate for Warwickshire. We're well below Solihull, Coventry, and the England average, and that's your hard work controlling your cases in the settings going forwards. That's just brilliant news of where we're at. The wards that have the highest cases, now these have come down. Some of these we're seeing like 120 cases in a ward. So Ben in Rugby, New Bilton in Rugby, Poplar in Nuneaton and Bedworth, Bed in Nuneaton and Bedworth, and Leamington Wiles in Warwick. Those are our areas of the highest amount. So that's coming down massively. And again, like I say, I'll present the early years data next week. So that just takes me back on to the question opening out to the group. Any questions or queries? It's all very quiet.
You've got 2 in chat, Jan.
Oh, brilliant. So what happened if staff have the vaccine and are booked for their second one? As in, what will happen is if they booked on and took it, as far as I know, if you're booked for your second vaccine, then go and get your second vaccine. But I think we probably need a bit more context on that one. I don't know if you want to unmute and ask a question, Josie.
Hi.
Hello.
Yes. A few of our staff have had the vaccine the weekend.
Yes.
Because obviously they got the message, so they went for it.
Yes.
But they've obviously booked in for the second one at the same time, so I presume they just go ahead and have it. Or
yeah, I think if you've already had one shot of vaccine, you're better off just having your second shot of vaccine. But yes, do you know where you got the messages from, Josie? Where did your messaging come from?
I'm not sure. One of the staff said that we were entitled to it, so we looked on a link and just were able to book it. Yeah. And there was no queries when we went for it.
Yeah.
So we just showed where we worked.
Yeah. Yeah, and when we are trying to address that now at the vaccine centres, and yeah, so just to say that some of the vaccine centres may, I mean, I'll double check and come back to you whether you should get one or not, the second one, and follow that up just to be sure. Because I would say at this point, if you've had one, you might as well go for your second one. But actually, they may say, I'll speak to the vaccine centres, and they may say, no, actually, don't come for your second. But I'll check that out and find out.
Okay, thank you.
No problem. So we aren't making LFTs mandatory for staff, but should we be temperature checking them on arrival at work as a matter of course? So when we look at screening staff using symptoms, it's not just the temperature one. And we have had this query from our dementia and our social care day centres. Actually, most cases that I've seen in early years and schools, it hasn't been a high temperature. In fact, most symptoms are a really severe headache, really high fatigue, as in like just feeling as if you're really unwell, and sore throat are the main ones. And if you look on the CDC, which is the American Centre for Disease Control, they labelled that as their main symptoms. There's the European Public Health and the WHO, they list those as some of their main symptoms. So that's what I'm experiencing on the ground. So if anything, it's asking your staff, if you feel unwell for any reason, don't come in. Please go and get a PCR test, because most places now, because we've only got such small numbers, the results are coming back well within 24 hours. Just say to staff, if you're feeling unwell for any reason, really, just really unwell in yourself, just stay off a day. Don't get me wrong, it's up to how you're viable on your site. And if you haven't had any cases and you don't know of anyone in your community that's had any cases, it's probably more likely to be a cold than it is COVID. If you do know of cases in your community, or you know of some parents or a local school that's had it, it's bearing that in mind that there's a possibility it is moving within your community. But I would say it's not just temperature, it's an array of symptoms, and it's feeling really unwell. And I don't just mean as in like when you get up and you just really can't be bothered, you know, when you're just feeling, because we're all feeling a bit of the, you know, the winter depression and the blues. It's more that you feel really ill, and as if someone's drained your blood a bit. I don't know if that's a way, as if like you just can't, and the muscle aches as well comes into that, and sore throat, etc. Once you've been for a PCR and you've had that cleared, you know, then you can take it from there and just say, you know, come back into work. If someone does come into work unwell, PCR test, and it's negative, and they continue to feel unwell, then they can go for another PCR test, and sometimes that is because the test was too soon. But I would just recommend that people are, if they're unwell, not to come into the setting. If any of these other symptoms is that PCR. So if you're unwell, feeling really, really unwell, I would recommend that you go for a PCR test rather than an LFT test. Now, obviously, I'm stating things like sore throat, headaches, and just feeling real severe fatigue and maybe muscle ache. So basically like flu symptoms. If you're feeling that, then I would recommend you go, because the speed at which the PCR tests are coming back really, really quickly, then I'd send them for that. If they're not feeling that unwell, as in like they just feel a bit like, I just don't feel I can today, I'm just not at my best, maybe, we're in a grey area. We'd rather people not go to LFT test centres if they're feeling very, very unwell. But if they've not got the top 3 symptoms like the temperature, cough, and loss or change of sense of smell, then technically they can. But what I've spoke to the test centres about is that they would rather people go for the PCR testing if they have like things like a severe sore throat, really feeling really unwell. They would prefer them go to a PCR test centre then come to the LFT test centre. But because we've got this weird situation with our government that they only recognise the top 3, they can technically go to an LFT test centre, and it's really you know, that balance of it. If they were going to go to work otherwise, if they were going to be like, well, actually, I'm going to go to work today, I don't feel my best, I'm going to go to work, then please send them to an LFT test centre first, and it takes 30 minutes and they can go and get an LFT test. If they feel unwell enough that they probably would consider a day off work, then they can send them for a PCR, and because they're going to take the day off anyway, then send them for a PCR. But I would be really mindful of people being unwell in your setting. I'm really sorry that sounds really grey and really confusing, but it is really hard of how you balance this, because I know that you need to keep operational, you need to keep running as a business, and the lesser symptoms aren't nationally recognised, but we are seeing people just with sore throats, just with feeling fatigue, and just feeling really unwell in themselves. And it's really hard of how we keep the LFT test centres as safe as possible, but then also use them as much as we can to keep people in work. So if you're going to go to work anyway, go and get an LFT test. If you're going to take the day off sick because you feel really unwell, probably go for a PCR. When a PCR test are sent back as negative, it states about returning to work if you've not had a high temperature for 48 hours. Yes, so if you before COVID, if you were unwell and had a high temperature, the guidance for any infection control for any illness, even if you have diarrhea, would be don't come to work if you've had a temperature in the last 48 hours. And that is still true for COVID, because you're not well enough to come to work if you've got a high temperature. You're too sick to come to work. It's for health and safety. In the same way as if you've got diarrhea, don't come to the setting, more so for that because it's infectious, but also because you're still resolving a sickness in yourself, so don't come to the setting. So with the high temperature, yes, same as before COVID, if you've been unwell for any reason, don't come in if you're sick, if you've got high temperature. But what we're saying here is if you haven't had the high temperature, you haven't had the cough, and you haven't had the loss or change of sense of smell, what do you do then? And I would just recommend, if you're really sick, don't come in, because we don't want a really bad cold going around in the setting equally, because that would create all of you to have a bit of a worry about the kids who are all snotty now, they're all ill now, and we know it's just a bad cold and that member of staff could have just stayed off. But then I also understand that you want to get people back into work as much as you can to keep your ratios, because you have people isolating, you have other things going on. I get it. So if you're going to come to work anyway, just say get an LFT, it takes 30 minutes. If they're going to take a day off sick, or you've got the ability to say, you're too sick, don't come into work, then please send them for a PCR. I guess it's just that balance of how you stay functional. Each time we attend LFT centres, different people get asked different questions. Is that for research purposes? So at the test centre, at the door, you are asked, are you a close contact of anybody? Should you be isolating? Have you tested positive? And do you have symptoms? You will always be asked for that. That's because we've got loads of people who are going to PCR test centres LFT test centres, which is for people who don't have symptoms, or the top three. These centres have been designed for non-symptom screening. So if you are an essential worker and you just want to check if you're carrying it without symptoms, that's what the LFT test centres are there for, to keep workplaces like your own workplaces as safe as possible and having screening. But what's happening is lots of people who should be isolating, who are sick with the top three symptoms, who have already tested positive, are rocking up to the LFT test centres thinking that if they've tested positive in the last 5 days, but they now test LFT negative, they can go back to work, or they can go and visit their grandma, or they're no longer infectious. And that's just not the case. So when they get to the door, those are things that you're going to be asked. When you go in, they register you, and they register you as part of the National Test and Trace system, so that we have things like, what's your address, what's your postcode, your age. Sometimes we ask things like, where are you from workplace wise? And that's the only question that we ask, that we look at as a team. So I look at that data to see how many people are coming from this setting, and I'm using that for my argument of trying to pay for and get more testing available and other bits. So when they ask you questions of which workplace do you come from, or what type of thing you come from, that helps me around building the business case around needing more support in different areas. And if we do have a large number of workplaces coming through, we're looking at that as well, of like, if it's construction or if it's something else, what can we do about being more strategic about planning our testing? So that's the reason why you get asked the questions, but they should be the same questions at each LFT test centre. But I guess it's with anything, whenever you roll anything out, you always get someone who does the training but then forgets half a dozen things that they were told to ask or do it. What's your advice on allowing children and or staff back in before 48 hours if they feel well and haven't had a high temperature since? So if you've had a high temperature, you should not be in the setting for 48 hours. The only time that I would dismiss that is when it's potentially teething. So we do know that some children get high temperature when it's teething. They get the runny bum and everything else. They get the rosy cheeks. They've got the mushy gums. If there is a child that has clearly got teething and has been for a test or is off because of teething, you can end up with a bit of a fight between the parents of like, that it's teething, they know it's teething, but you're following the national guidance. If you haven't had any cases in your setting and the families haven't had any cases at all, then if you know that it's clearly teething, then I would say that you can probably use your own discretion for that. If someone has been unwell, really unwell in themselves, not teething related, the national guidance before COVID is to not come back because they are sick. So they should wait 48 hours after a high temperature to come back. If you've accidentally slipped or brought someone back because they do feel fine now or whatever, then that's okay because that's happened now, and we're not here to bash anybody. But it's just better practice, and it's the best practice that if you're unwell and you have had a high temperature and you've been clearly fighting a sickness, that you should give yourself 48 hours before coming back to the setting. That also means that anything like really bad colds don't go through your setting, because if they've caused a high temperature in that member of staff or that child, they're likely to do it in other children and other staff in the setting. And with COVID circulating at the minute, it just scares people that you've got a large number of kids or staff that are suddenly going off with this high temperature. Now, as a setting that it likely came from that child who was unwell or that staff member who was unwell, and that they didn't test positive for COVID, and it's fine. But it could be creating a situation whereby you've got families who end up self-isolating. You've got other things in the mix there. So I just would recommend that if someone has been sick and they've had a high temperature, legally, if it's not teething, legally they've got a high temperature, they have to go and get a PCR test, because that is within the top 3 symptoms. And if they're test negative, and it's not COVID, they still aren't to come back to the setting, because actually they're still sick with something and have been recently, and we'd rather them just give themselves 48 hours to recover from that and come back to the setting. I hope that answers that one. But do come back to me if it doesn't, or again email early years and we can clarify that one. That covers most of them. Any more questions for the group? All very kind. I do love the fact that everyone's putting questions in. That means that you're engaging, and it warms my heart that I'm actually answering some questions and people are listening, and that you're not turning up thinking that sort of I won't interact. It's brilliant that you're asking those questions.
Leanne, can I just chip in with something here in relation to notifying cases? We're still getting the DFE telling people that they will let public health know and that no further action is required on behalf of the setting, but we always need you every single time there's a case in your setting to complete the online form, please. And on another note, we've had some queries from settings who have been contacted by Ofsted, who are telling them things like they should be notifying the Department for Health that they've got a case in the setting. Nowhere in the actions for early years and childcare settings does it actually say that. If you get that sort of situation with an Ofsted inspector, just signpost them back to the guidance. It's actually in section 10 of the system of control. So I've just put that in the chat function. And the exclusion tables, so where Leanne's talking about keeping children off from the setting, I've just put the link to that as well. Thanks, Leanne.
Just to add to that as well, actually, we've recently had a couple of settings say that DFE, when it came to their further cases, that they said you don't have to inform anyone when there's further cases, and that you don't have to go back to DFE for sure. So I don't know whether DFE have recently informed some people that they, when it comes to any further cases, DFE have said you don't need to let us know if you've got any further cases. That wasn't our understanding. So just to kind of let people know that. And also, if you do have further cases, do report them to our online reporting form. And if you do get a few cases and you start to feel that this is losing control, please do contact the early years team, for advice and guidance. Sometimes there's a bit of a delay. So if over the weekend you inform DFE and the WCC reporting form, or even across the week, I may not necessarily pick it up as your cases are accelerating. So you may have a couple in a day and then another the next morning, but I haven't downloaded the Excel sheet because I've been working on the previous day's data, so I haven't got to yours yet. So if you do have it suddenly explode in your setting, don't wait for me to contact you. Contact the early years team on the email address, and I will be in contact to kind of help you with, guide you through it. What's happening is a lot of people are calling PHE, and PHE are just saying, well, it's up to you what you do. This is the advice and guidance. It's up to you what happens next. You're not to be left on your own like that. In my view, do contact the early years advisory email. They will contact me, and we can work out what's happening from there and give you some more help and support. It's not just for you to be left on your own like that. So please do get in contact. Great. Oh, that eerie silence at the end. Okay, great. Well, that's everything for today. Again, you've got the early years contact details, same time next week, and I will do an early years presentation for the data for next week, which obviously, as the cases are coming down, it's really good news across the county. But I will present that data next week.
Okay, thank you, Leanne. We are, as ever, very grateful to you for your support. Have a good week, everybody.
Thank you, everyone, for dialing in. I really do appreciate it. Thank you all. Take care. Bye. Bye-bye.